that's correct, Frank. The statistics are really quite alarming when you look at them. There was one study that in 2009 found that 40% of America's children 10 and under were overweight or obese. And when you look at Florida statistics, that number jumps to 53%, according to this one report. 53%, so over half of all children in Florida are overweight or obese. These numbers are very sobering, and clearly something has to be done about it. So joining us today are three doctors from All Children's Hospital. The one directly next to me here, Dr. Raquel Hernandez. She is Associate Director for Medical Education, and you are also a pediatrician. Welcome.
Thank you.
Also with us, Dr. Pallavi Iyer. She is Director of Endocrinology for All Children's, and we will be joined by a third one in just a minute, as soon as we can get her mic'd up and over here. That's Dr. Sheila Devanesan, and she's an OBGYN. But I want to start with you because these numbers have tripled in the last 30 years. I mean, this is indeed shocking, alarming, disturbing, right?
All of those things. I think all three of us are passionate about the obesity epidemic because it truly is an epidemic today. And I think we've become passionate about it because it is a significant challenge to change behavior for young kids. And so the strategies that All Children's has really embraced and tried to enforce both for our patients, our community, is advocating for a family approach so that interventions are not child-specific, that it's really a family intervention that you're proposing for very young kids. And I think we all agree that the epidemic will really only start to be curbed when we start to identify kids earlier and start to get them into effective programs sooner. I think that's been a challenge thus far.
Dr. Iyer, you know, I don't remember growing up seeing this level of children in school overweight and obese. What in the world do you think is going on here? What do you think are some of the causes?
I think you can go back to genetics and say that we have genes that protect us from starvation, and those genes were great back in the caveman days when you ate this much food and that energy lasted for long periods of time. Or when you were in a developing country and you didn't have a lot of access to food. And you walked everywhere, you took stairs everywhere. Well, we're very pleased to be in a community where we have access to food and access to things like cars and elevators and air conditioning where we don't need to use those things. However, our genes come back to bite us at this point. So at the end of the day, it's food in, exercise out that makes us have stable weight. But we've been eating more and exercising less, so there's more food that we hold on to. And those genes just work against us. But the best thing to do is to talk about the healthy communities, make this a true issue. It's not that, oh, they look healthy because they're a little bit overweight, but think about the fact that these obese children become obese adults, and the thoughts about diabetes, high blood pressure, cholesterol problems, those things will start earlier and earlier, and we really want to prevent it because that's what we're in the business of in pediatrics, is preventive care.
I think we have Dr. Sheila Devanesan, who's mic'd up now. Can we have her come in and join us in this conversation about the epidemic? Hello there, when you sit right there in front of that mug. Nice to meet you.
Nice to meet you too.
Good to have you here. Talking about the alarming epidemic of obesity, and I was just asking the other two doctors here, physicians, what they felt is contributing to the rise in obesity in our nation's children, and Floridians too.
Yeah, I think it's multifactorial. There's definitely an environmental contribution there. You know, the kind of lifestyle that's being set up in the family home, in the family unit. We're looking at genetic aspects. You're also looking at even biochemical. I'm actually an obstetrician, and one of the things we're concerned about is actually the communication between the fetus and the mother during pregnancy and how that might affect risk for diabetes, hypertension, and childhood obesity.
In the womb?
In the womb.
What do you mean? How can that be?
Well, there's still a lot of research going on looking at these aspects. We don't exactly know how that interaction is happening 100%. But we do know that moms that are obese, which in our reproductive age group is about 60% of moms are overweight or obese right now when they enter into pregnancy. And in that age group, we're seeing with pregnancy they're at higher risk for delivery complications, cesarean section, bigger babies, and those children are higher risk for obesity and diabetes in childhood.
So an obese mother gives birth to a child, and there's a much higher percentage that that child will turn out to be obese as well?
Absolutely.
Absolutely.
So genetic, or what they're feeding them, or?
It's all of the
That's-
above.
That's the complicated factors, that it's all interweaving, so.
So, I mean, you have the genetics potentially, then there's the environment, what the fetus does in the environment where there's plenty of food around. Are you trying not to hold on to that? And then how the baby lives in that same environment when they come out of the womb and out to the world and being fed more and exercising less. So trying to tease out which part of those three things is really the cause for the epidemic at
Okay,
this
so
point.
does anybody believe there is a fat gene?
There are several fat genes.
There are several fat
There are
genes.
several
Oh,
fat genes.
great.
Yeah.
But what
right.
we can do about it, we don't know yet.
Well, but the key, I think, what we're all talking about is that it's so complicated in terms of identifying one potential
It
cause.
is, isn't it?
So really, the strategy then becomes not necessarily identifying the cause, but sort of early identification. So as you were saying, Dr. Devanesan does work to identify high-risk moms. We then know that those children, those infants, are high risk. So previously, as a pediatrician, you'd be okay with a pudgy little baby sort of kind of trucking along at
Yeah.
the higher growth curves, and you'd tell the mom, you're doing a fantastic job. Today, I think all of us are taking sort of more caution and advising moms to say, well, tell me more. How much formula are you giving him? When are you introducing solid foods? And what sort of activity is your infant or toddler doing? So it becomes an issue of changing perceptions, as you said. Societally, I think we're more cautious about size earlier on. So even before, where, as I was telling you, preschoolers at 2, would be applauded for being sort of big and husky.
Right, right.
I think today we would approach that child a little bit with more care and more questioning about their nutrition and their activity.
So with all due respect to some of the reality shows I've seen that have really obese children on them, what are the youngest children you're seeing?
Well, actually, if you look at the preschool age children right now, 2 to 5, that's their incidence of obesity has doubled. They're actually about 10%. And to me, that's a significant one for what I do, because the 2 to 5-year-old age group is really impacted by mom and mom's habits.
You're
and the
seeing
kind of
overweight 2 to 5-year-olds?
Absolutely.
5-year-olds.
Absolutely.
How much overweight?
It can range. I mean, we've seen different tiers of obesity, but there are some 2-year-olds that are technically obese, morbidly obese, because of the perception that their growth has been fine, and lack of education on the parent, community, and provider side to have intervened a little bit earlier. So our Fit for All Kids program at All Children's actually now allows for even younger kids to begin into some of these really fantastic programs that we have. So even at 3, we're offering physical education intervention, culinary lessons, so that the family understands what's appropriate portions. That can be very confusing for families. And then in addition, we watch them. We watch them much more closely than they previously would have been, so that we can account for some of those nuances in physical activity that can happen for young kids.
I wanted to ask you about something that I found a little confusing and contradictory, that information supplied that All Children's provided, and it said from birth, some of these children are often overfed and undernourished.
Right.
Can you be both?
You can be. I mean, nutrition is not just calories. It's also all the little vitamins, protein, fat, all of those things put together. And so when we talk about empty calories, so drinking your calories, drinking juices and sodas and sweet teas and lemonade and Gatorade and Kool-Aid, we all like that, but we used to think of them as treats.
Right.
And now these are what we drink with our dinner and our breakfast and our lunch. But they provide a lot of calories, but they don't provide sustained nutrition. They don't provide satisfaction for
Right.
long periods of time like a true square meal would. And I think that leads to perceptions, right? I only ate this much food, but really I ate this much food and this much drink, and I didn't even account for those empty calories.
I had some chips, and I had a soda, and I had a granola bar or something, and you've had only this much food,
Right.
but nutritionally, it's very empty.
It's a lot,
Well,
and
I'll give you an
especially for
example.
younger kids too.
In my office, we're seeing pregnant moms, and I was a little disturbed one day seeing my mom, and she had a child who was probably about 2 years old. And as I was examining her, the child was drinking Coke and eating Cheetos. So there's clearly a misunderstanding of what's healthy for the
Yes.
child and establishing those healthy norms. All Children's is a unique opportunity. I don't know if you're aware, We are one of the only children's hospitals in the state of Florida that actually houses a maternity ward within the hospital. So it gives us a unique opportunity to address this problem of obesity from all avenues. We can address it not only from the childhood standpoint, but from the perinatal standpoint, educating moms, teaching moms how to create a healthy environment for their children. And actually, as like Fit for All Kids, we also have Fit for All Moms, which is a program where we're trying to help women during their pregnancy who enter into pregnancy overweight and obese to learn the way to eat, how to create a healthy environment. And it's a time when moms are really motivated to make changes.
So Sheila, did you take those Cheetos out of that woman's hand or what?
Yeah, I should have.
Did you? Now, let me say, all three of you are mothers,
Right.
and I'm a mother, and I have to ask you, don't you find in today's society and environment, it is hard
Oh, absolutely.
to strike that balance between what your kids want to eat, what they have access to, and what you want them to eat? How do you do that?
Absolutely.
What are you doing? What's your
So
strategy?
different- I mean, my strategies are really to make at least our own food environment in the house one that I'm okay with them going in the pantry and taking out a snack. So I don't buy the high-calorie Cheetos, chips. I try to buy all healthy baked goods. I try as much as I can to get our refrigerator stocked with produce and vegetables. So locally, in our house, I try to control that. I also try to address what I call the grandma effect, which sometimes is the grandma
We all
comes
know
in
that.
and
Oh,
really
honey, keep eating,
doing
keep eating.
Would add some
chocolate,
butter
there's
on
some
it.
ice cream. So I think, but that's the educational piece, is that I think as families, if we encourage families to understand what the goals are for our children, then I think it's easy to have those conversations with my mother-in-law or mom and say, Mom, it's just not tonight. We don't need that dessert. They had a great meal. Let's get them outside. Let's get them to walk. And so those are some of my initial strategies with my young kids, because it is difficult.
It's very difficult.
I think instituting the table time again, it's really hard to do because everybody is on the go, soccer practice, after school, after work meetings, those kind of things. But really, at least trying to sit down and eat at a table 4 or 5 days a week.
Absolutely.
Sit down, talk about how was your day. And if you eat slower, your body has time to realize, hey, I'm full, I don't need to eat anymore. Whereas when you're shoveling food in front of the TV, you don't have those cues. So to me, that's been really helpful. And at least those 2-3 times a week, we're
Yes,
slowing down.
right.
And then afterwards, let's go for a family walk. We got done with dinner. We live in Florida, let's enjoy that. And year round, we can go for walks, we can go play, we can, throw the frisbee around, whatever it is. Yes.
Absolutely.
But on a very serious note, the health risks of obese children contributes to type 2 diabetes, which is going through the roof, cardiovascular disease, hypertension, orthopedic problems, pulmonary. In children, this almost seems
And it's
not
not just
even
the
real.
medical illnesses, it's also the psychological.
Yes.
Teasing in school,
Bullying.
in school, self-esteem and image, and that all plays such a big role in how these children develop and how they progress in their lives.
And their self-image. That's really what I see a lot more of being in endocrinology is the effects of not preventing obesity in childhood, seeing children as young as 5-10 years old with type 2 diabetes, which never is something we used to see. And that's really sad. But I take that as an opportunity to teach the whole family, because usually it's not just one individual in a
Right,
family
yes,
that's going
it's a
through these
system,
things, and say,
yes.
listen, this is a great opportunity for everybody in the family to start eating healthy. Nobody needs to be drinking juices and sodas. Everybody can be drinking, water, skim milk, and those sort of things. And because hopefully if we treat one person with type 2 diabetes, we're preventing 4 other people in that family from getting type 2 diabetes.
Well, Dr. Iyer, you mentioned the sugary beverages. I want to talk a little bit about prevention and what your ideas are about trying to get ahead of this curve. The sugary beverages are one. The affordability and availability of healthy foods. I know that that's been talked about a lot.
Absolutely.
Do you feel like that there's a lack of available and affordable healthy options, or their parents just not know?
There's both.
Yeah,
Go ahead.
so I would say that, looking at this from a from a national standpoint in terms of food environment. That's one of the huge areas of research in obesity. That, you know, definitely urban areas are much more unlikely or higher risk to provide calorically dense food. So fewer produce opportunities, fewer grocery stores.
Calorically dense meaning?
So meaning your typical Twinkie, your typical sort of...
Your typical Twinkie.
So the very flour-rich, anything that's processed is typically
Easily
calorically
absorbed
dense.
and but does not satisfy you for a long time.
So the work in the food environment is very key, and that's something that with our programs and with the region that we have, we're hoping to, one, address the issue, as you said, to educate families, because some people have never tried, for example, a cucumber, have never tried, you know, a pineapple, have never exposed their child to that because that's not what they were exposed to. So the issue of education is one. We're partnering with Kohl's and doing a number of culinary lessons for families in the community to show them how to cook that food. The other part of it is certainly policy, and is certainly the legislation related to how much funding a certain community can have to have a Publix or to have a, you know, a grocery store that's available to low-income families. And there's disparities throughout the country in terms of that. So we're fortunate to have a community like Tampa, St. Petersburg, where we have tons of physical activity opportunities for children year-round. We have growing interest in preventing the problem with better food environment, better food education for families. So we feel very confident we're taking the right steps, and we've seen some fantastic outcomes already from some of our patients. It's very rare in the world of obesity to see weight change in children, but you'll see, I think, a story later on about one of our patients who's had fantastic improvements. And we're seeing that more often. So I think we're all, I think, feeling that we're doing something right together with the collaboration that we have and the passion that All Children's has.
Yeah, we do have a video from All Children's talking about one of their initiatives. I think this is some video from your recent telethon. But let's roll that videotape so we can talk a little bit more about what All Children's is doing for the epidemic of childhood obesity.
At All Children's Pasco Outpatient Care Center, there's a celebration going on.
Congratulations. Good job.
Kids being recognized for losing.
This is amazing. Look around this room.
So far, he has lost 11% of his body weight while enrolled in the program, and
They're part of the All Children's Fit for All Kids program. Family nutrition and fitness guidance provided through their doctor's office, A to Z Pediatrics in Newport Richey.
first, I want to call up Jonathan Frederick. There you go. Jonathan has not yet graduated from our program. However, so far he has lost 12 pounds. He's lost 3.6 body mass index points, and this equates to 9.5% body weight loss so far, and he's not done yet.
Jonathan is one of nearly 50 A to Z patients who've joined the program since November of 2010.
Well, I'm doing good because every day I go outside, play with my friends, ride my bike.
For All Kids
I'm in shape.
So that he did the program that we have.
All right, that was Jonathan. Tell me a little about Jonathan's story.
So Jonathan is one of our many success stories that we've had through his involvement in the Fit for All Kids program. So you saw one of the community practices that is embracing Fit for All Kids, and many of our patients have now graduated the program and have shown, as I mentioned to you, some significant weight loss, which is very hard to do. So we feel that the motivation from the families, the fact that the programs are tailored to the family's needs, we're no longer telling people exercise more and eat less. That just doesn't work anymore. And so that's what Fit for All Kids really does, is advocates for that family's needs. Jonathan had a fantastic experience, and you can see he was thrilled.
I know. So eat less, exercise more. I mean, that's clearly calories in, calories out. But if you say we have to go beyond that, it's more than that. What do you mean?
So the tools, simple things, it's something you think about every minute of every day. So when I go to the grocery store, this is one great trick I learned. I try to shop on the outside of the grocery store.
Yes, the outside
right?
aisles.
So the produce aisle, the meat aisle, the dairies, cut down the frozen vegetables, not the ice cream aisle, and come back up front. And I will say you save money, time, and calories. Why not? And I think when we were talking earlier about learning about access to good food, I think it's our perception that fruits and vegetables cost more than the Twinkies and some things of that nature. I think they cost just as much. It's not that we're asking people to eat fruits and vegetables on top of the Twinkies, we're asking them to eat fruits and vegetables
Instead
instead
of
the
the
Twinkies.
Twinkies, yes.
And so then the pricing comes down a little bit, you know,
And I
and
think
thinking
also,
about that.
It's important to involve the whole family unit. Kids mimic what they see their parents and other children in their family doing. And so, getting the parents out and exercising and setting healthy lifestyle experiences for those children is a big factor here. So many of us have gotten more sedentary. We're on our phones, we're on our computers, we're watching TV. We're not getting out. And again, like we talked about earlier, Tampa Bay is such a great area to really implement that. Going after school, take the kids over to the beach and go for a walk on the beach for an hour instead of going straight home. That's exercise, it's family time, things like that. So really getting the whole family unit involved in transitioning this lifestyle to a healthier lifestyle is really what it's all about.
I think the concept is changing from a hospital, all children's hospital, being only a place where people come if you're sick to be treated. It seems like what you're saying is we want to be more proactive in the preventive area, especially when it comes to obesity. And I love all of your passion about this. What makes it conducive for you to do what you do in Tampa Bay versus living someplace else?
Well, I'll give you an example. I was in Baltimore for 10 years for my training, and I had young kids there. And during the cold months, it's tough. You've got to bundle your kids home. You've got to ship them from the house to school, and it's hard. It's hard to get them outdoors simply because of the climate. In addition, I think each city has barriers in terms of what programs they offer. Some programs really offer the best activities for school-age or adolescent children. And so what that does is it's fantastic for the school-age and adolescent children, but at some points it's a little too late to start doing physical activity just as a teenager, as a school-age child. So the beauty of Tampa Bay and St. Pete is that we're embracing the outdoor advantages of being bayside and being in a beautiful climate. But also, I think we're creating some really fantastic programs for younger kids. And so why I think we are able to achieve what we do is a combination of the community that we're in, the climate, and also the focus on earlier identification, which is what we've all sort of advocated for.
And along with exercise, being able to do that year-round, we're able to grow in our gardens and just teaching people, hey, look, if you grow this tomato, you grew that. Now you can eat those cherry tomatoes, and just introducing that for little children from that perspective as well.
Yeah.
Yes.
That's
And
true.
our community too,
Yes.
again, getting back to just how great All Children's is, and our community resources like YMCA and Kohl's, they support us. So all of these things were born out of our interest in impacting, clinically impacting our patients and our patients' lives, but we've garnered support from the community, from All Children's, that allows us to move forward with those ideas, which, that's huge.
And also the interest in the families. I think families are starting to realize this is an important issue, and they want programs out there.
They
They
want
want to be helped. And I think that really is the major impact, is that having that motivation. If they have the motivation, then it's so much easier to carry out your work.
And that mission of education.
Right, education, and the one thing we haven't mentioned also is kids being inside so much, either academically, PE programs are not as abundant as they used to be, video games, watching TV, things like that. I mean, there is an issue of lack of activity that feeds into this as well.
Sure. And that's a national, it's everywhere, and I think Florida is affected by that as well, but I think that we're trying to carve out those small pathways where families could be more active with their kids at an earlier age that would not necessarily substitute, but at least add on to the physical education that they get in school, because we all agree that's not optimal, and that needs improvement. It's a federal issue in terms of getting more schools the funding that they need, but I think families who demonstrate an interest, and as we're all saying, we want to be that resource. We don't want to be just the treatment of type 2 diabetes or the treatment of their GI issue. We want them to come to us as a resource and say, what could I do for my child?
Before I get to that point.
Yes, before I get to that point. What are you feeding your kids for dinner tonight?
Oh, I haven't thought that far
Fish
ahead.
tacos.
Fish tacos.
I actually love it. They put all sorts of little stuff.
We're going to her house tonight.
Coming there.
That sounds fabulous.
Do you pack your lunches for your kids?
Yes.
Oh, wow.
Absolutely.
Everybody said yes.
At least 4 days a week.
Yeah.
Really?
Yeah.
And you know they don't trade with their friends for 20?
Oh, that's a tough one. I think it might be a factor, but it's that sort of peace of mind where I know what's in their lunchbox, and I know that for the most part, 80% of what they're going to eat that day is going to be what I sort of approve of. And in addition, I think it lets me know that I can pack water for them and not have them necessarily get the fruit punch or lemonade at school, which is sort of what the easiest fixes are the high calorie, and then the other interventions that we've talked about are really the family telling us, I think that I could do this, I think that I could do that. Well, let me give you the resources you need to do those things. So,
how does the fact that you're moms impact what you do for your profession as doctors dealing with children?
I think, just having an honest discussion like we were discussing before. At the end of the day, less calories in, more calories out. But that doesn't always happen. We know the challenges. We all work full time, and then we have families, and our husbands work full time. And so it's not going to happen all the time, but every time you can make a difference, you should. And so listening in that manner, listening to our families and saying, these are the barriers to doing this, and having some real strategies to try to change those barriers. Think about other ways of approaching the issue.
That's the art. That's the art of medicine, really being able to identify the challenges that our patients are facing, be able to understand them, and help them to find strategies to overcome those.
So being a mom yourself allows you to better identify with what the women and men in your office are telling you, because you have that same struggle also.
I think all of us have a high level of street credit when it comes to some of the issues that we deal with, because we've all had fights about lollipops at the store. What do you do when they want a lollipop? Well, you've got to have that discussion with them probably ahead of time. You've got to set expectations for them. We've all had discussions with, as I mentioned to you, our family members not making great decisions for our kids. How do you address that? So the street credit, I think, as Dr. Iyer and Dr. Devanesan are saying, lets us empathize with our patients and lets us provide more realistic recommendations to families. Whereas I think if you had talked to any of us 10 years ago before we were moms, we might have given you some impractical recommendations, and we might have said, well, why didn't it work? And now I think that really, I think, adds to our sort of clinical knowledge and patient knowledge.
Yeah, 10 years ago. You might have had a different point of view. You always do your best parenting before you're...
Right. It's always easiest then.
But, also realizing that there are times for treats, and that's okay.
Yes, I was going to ask about that.
If you have a birthday party, you go to the birthday party, you have
You
that
have
piece
cake,
of
and
cake.
you
don't
have
have the biggest piece of cake, you don't need all the icing on top, but you have a piece of cake or for whatever. But the idea that treats are every day after every meal, that needs to change. Treat is really a treat. It's for special occasions. We don't have special occasions 3 times a day.
Yeah, that's a good point. You don't want to have your kid be the one at the birthday party who says, no, my mom doesn't allow me to have a piece of birthday cake. But it's not every day. That's a great point. Wow. Great discussion, you guys. If you guys are on the front lines of treating obesity, I think we've got a good shot at doing something about it. Thank you so much, Dr. Hernandez, Dr. Iyer, and Dr. Devanesan from All Children's Hospital. Thank you very, very much.
Thank you, Kathy.
Coming up next on Front Row Tampa Bay, a different kind of health record. This one's for your car.